Fatal complications of maxillofacial infection. At the end of this lecture, the student should gain information about: first, different fascial spaces infection in the maxillofacial region. Second, the neurologic considerations of maxillofacial infection. Finally, fatal complications of maxillofacial infection. Relation between fascial spaces. Mandibular spaces. Submandibular space. Anatomic boundaries. The boundaries of the submental space are: the mylohyoid muscles superiorly, the investing layer of deep cervical fascia, and this in turn is covered by the platysma muscle, inferiorly, the inferior border of the mandible anteriorly, the hyoid bone posteriorly, the anterior bellies of the digastric muscles laterally. Communications. The communications of the submental space are: the submandibular spaces posterolaterally, the sublingual space superiorly, above mylohyoid. Contents. Its contents are submental lymph nodes, areolar connective tissue and the anterior jugular veins. Submandibular space. The submandibular is a potential space, and is paired on either side, located on the superficial surface of the mylohyoid muscle between the anterior and posterior bellies of the digastric muscle. Anatomic boundaries. The anatomic boundaries of each submandibular space are: the mylohyoid muscles superiorly, the skin, superficial fascia, platysma muscle and superficial layer of the deep cervical fascia inferiorly and laterally, the medial surface of the mandible anteriorly and laterally, the hyoid bone posteriorly, the anterior belly of the digastric muscle medially. Communications. The communications of the submandibular space are: medially and anteriorly to the submental space, located medial to the paired submandibular spaces, separated from them by the anterior bellies of the digastric muscles. Posteriorly and superiorly to the sublingual space, located above the mylohyoid muscle. Inferiorly to the lateral pharyngeal space. Contains. The contents of the space are: the submandibular gland, branches of the facial and lingual artery, lymph nodes, hypoglossal nerve, masticator space, the four compartments of the masticator space: temporalis muscle, masseter muscle, lateral pterygoid muscle, medial pterygoid muscle. Masticator space is a collective name for superficial temporal space, deep temporal space, submasseteric space, pterygomandibular space. Masticator space contains the mandibular division of the trigeminal nerve and the internal maxillary artery. Maxillary spaces. The canine space, also termed the infraorbital space. It is located between the levator angularis muscle inferiorly and the levator labii superioris muscle superiorly. Boundaries. The boundaries of the canine space are: the nasal cartilages anteriorly, the buccal space posteriorly, the quadratus labii superioris muscle, levator labii superioris, superiorly, the oral mucosa of the maxillary labial sulcus inferiorly, the quadratus labii superioris muscle superficially, and the deep border is created by the levator angularis muscle. Communications. The canine space communicates with the buccal space posteriorly. Contents. The contents of the canine space are the angular artery and angular vein, the infraorbital nerve, a branch of the maxillary division of the trigeminal nerve. Buccal space. The buccal space is superficial to the buccinator muscle and deep to the platysma muscle and the skin. Boundaries. The boundaries of each buccal space are the angle of the mouth anteriorly, the masseter muscle posteriorly, the zygomatic process of the maxilla and the zygomaticus muscles superiorly, the depressor angularis muscle and the attachment of the deep fascia to the mandible inferiorly, the buccinator muscle medially. The buccal space is superficial to the buccinator. The platysma muscle, subcutaneous tissue and skin laterally. The space is deep to platysma. Communications. To the Submandibular Space, Infratemporal Space, Submasseteric Space and the Lateral Pharyngeal Space posteriorly. To the infraorbital, canine, space superiorly. Contents. The buccal fat pad, the parotid duct, the anterior facial artery and vein, the transverse facial artery and vein. Parapharyngeal space. The parapharyngeal space, also termed the lateral pharyngeal space. Anatomical boundaries. Lateral and inferior to the parapharyngeal space is the carotid sheath. Behind both the parapharyngeal space and carotid space lies the retropharyngeal space, and deep to this a potential space known as the danger space. The danger space serves as an important pathway for complicated infections of the posterior pharynx to enter the chest and spinal column. Anterior to the parapharyngeal space is the masticator space, which contains muscles of mastication, the inferior alveolar nerve as well as branches of the trigeminal nerve. Lateral to the parapharyngeal space lies the parotid space, which contains the parotid gland, the external carotid artery and facial nerve. These anatomical boundaries make it continuous with the retropharyngeal space. It also communicates with other cervical and cranio-fascial spaces, as well as the mediastinum. Contents. Maxillary artery, ascending pharyngeal artery, glossopharyngeal nerve, vagus nerve, internal carotid artery, internal jugular vein and the carotid sheath, accessory nerve, hypoglossal, sympathetic trunk and superior cervical ganglion, ascending pharyngeal artery, deep cervical lymph nodes. Retropharyngeal space. The retropharyngeal space is bounded by the buccopharyngeal fascia anteriorly and the alar fascia posteriorly. It contains the retropharyngeal lymph nodes. Because serious infections of teeth can spread down this space into the posterior mediastinum, it is often called danger space. It extends from the cranial base above to the level of the diaphragm. Relations of the retropharyngeal space. Superior, base of the skull. Inferior, superior mediastinum. Lateral, carotid sheath. Anterior, buccopharyngeal fascia. Posterior, alar fascia.